A weight has been lifted off Dr. Paul Saba's shoulders after learning Quebec won't require healthcare workers to be vaccinated.
We need to encourage people to get vaccinated, but it made no sense for the government to fire people who were not vaccinated.
Dr. Saba is part of a group of doctors who have been scrambling to keep the Lachine Hospital's ER open, which is set to partially close on Sunday due to lack of staff. He says enforcing the mandate would have made things worse.
It's a domino effect. The government would have caused a terrible disaster. They were wise to step back.
The province announced on Wednesday that it would back down from requiring healthcare workers be vaccinated, arguing projections show that the network would lose about 8,000 workers who are in direct contact with patients, and that would mean more cuts to services.
Of course, we look a little awkward because we supported the minister in his mandatory vaccination, and now we have to backtrack also. But listen, do we have much of a choice? The system is very fragile.
Instead of a vaccine mandate, Quebec is putting in place a testing alternative. Those who don't have the shot will have to be tested for COVID 3 times a week or face suspension without pay. Only new employees will be required to get the jab. Liberal health critic André Fortin believes that unvaccinated employees should be paying for their own tests.
Why would the government pay for that? It's their decision not to subscribe to the vaccination process.
This doctor thinks lifting the mandate is disappointing and a waste of countless hours that were put into trying to enforce it.
And those are hours that could have been put in trying to increase the amount of services, reorganize the system, knowing that you would be full staff.
The Canadian Medical Association calls it a bad move and claims lifting the mandate is a sign of an ongoing system failure. Gloria Henriquez, Global News, Montreal.